My name is Elisa, and I'm an RN on D1.
I'm Martha Barrier. I'm the Patient Care Manager on D1, CCU, and CSU.
I'm Teresa Cotter. I'm the Assistant Patient Care Manager on day shift in D1.
I'm Olga Chavez. I work here on D1. I'm an RN.
D1 is a cardiac medical intensive care and step-down unit.
Half of our unit is the cardiac ICU, which is critical care, and then the other half is what we call an intermediate ICU, so a little bit less acute than the ICU.
We can get some of the sickest patients in the hospital, and as they get better, they are able to literally be rolled between a set of double doors over to our step-down side, where they're nurtured and cared for by the same quality of nurses that they've had in the intensive care unit.
Physicians know that they can keep a patient in CSU a little bit longer where they may just be on the cusp, and they can stay here in CSU because we know how to manage them.
In our multidisciplinary rounds, team rounds, it was an organized project by the hospital that we really embraced on D1. We have 4 different groups of physicians who typically will come and report on our patients. During the team rounds, we talk about patients and today's care for the patients. Knowing that big picture and knowing what the trajectory is, and everybody being able to say the same thing to the patient and to the patient's family is really important.
There's a lot of teamwork here, and the patients feel it. I think the patients and the family, they know you, whether you've ever been their nurse or not, because you come in and arrange their sheets or give them a back rub or just listen, sit down and listen to them.
We all take a lot of pride in the care we give to our patients. Our patients mean a lot to us. Some of them are on our unit for a long time, so we get to know them very well.
It's just a great team here, and really the people are outstanding.
When we start as a new grad, it's very nerve-wracking. So we're assigned a preceptor, which is different from the mentor. The preceptor kind of trains us, teaches us what we do on the unit. And then once we're past that 6-month period, we're able to pick a mentor. And that's sort of somebody that you feel comfortable with, more of like a friend type of person.
The whole goal for this 3-year program is to support new staff, to make sure that they sort of have a friend, a buddy, someone that they can go to. It just really encourages that support system here at the hospital, and particularly here on D1.
The nurses here they strive for excellence in outcomes, and when you come in, like as a new nurse, the new nurse sees that and they have no choice but to be that.
And that's just what we do and who we are. We teach and we share the knowledge that we have. Being a team is that you don't work in a silo, that you work together and you help each other and you lift each other up. And when you're having a bad day, somebody else notices and they help lift you up and carry you through that day. The nurses on D1 are just amazing.